Buju, Gobzon Dishnakas, Namebin Dodam, Kajanan Dunjaba, Badwadamikwa Endel. My name is Kyla Stonefish. I am a daughter, a mother, a sister, an aunt, and a cousin. My mother is Janice Isaac, and my father, Roy Isaac, and my grandparents, Don and Jean Isaac of Walpole Island, as well as my grandparents from Kettle and Stony Point, Bruce and Hilda George, have all passed on. My children are Donica and Marquez Stonefish. I am a proud member of the Walpole Island First Nation, and I have been registered with Kettle and Stony Point First Nation, where I reside with my family. I'm the supervisor of the Walpole Island Community Health Program, and I've been a community health nurse for several years. My family instilled a strong sense of community in my life, and working with Indigenous people and promoting the overall health and well-being, as well as our rights and freedoms, are ingrained in my identity. Being a nurse is not a job. It's my role in the community, with responsibility to use the knowledge I have to help our people reach optimal health. I was born at the Sydenham District Hospital in Wallaceburg, and I grew up in between Walpole Island and Kettle Point First Nations, and my family lived in Six Nations for a little while as well. I decided to go into healthcare when, after high school, my father suggested that I become a nurse. Originally, I decided that I wanted a cushy job at a resort teaching golfing and surfing lessons to tourists. But my dad had a really high regard for the community health nurse that worked in Walpole Island. Her name was Miss McRae, and he really wanted me to become a nurse. My mother was also a community health clerk at Walpole Island and Kettle Point First Nations, and that really weighed heavily on my decision. All of our area has been part of the Three Fires Confederacy, so all the First Nations in the area were all part of one big reserve at a time. When they first announced the novel coronavirus, it really concerned me. We were in St. Regis Reservation in upstate New York, and I was working in a treatment center there as the nurse. I loved the community, I loved the location, the people were great. But my family was in Canada and they were 6 hours away, and looking at the fact that it was a coronavirus, I didn't think the pandemic would be really small. I just didn't think it was going to be a minor pandemic, so I wanted to get back and be with family. So we made that decision and we left right away before the borders got closed. The pandemic has affected our local First Nations in a manner that non-First Nations communities aren't affected. A lot of people have large extended families and live close together. So we have a lot of really supportive activities. So we see people on a daily basis. So not mixing households is a foreign concept. People see each other, we check in on each other. And right now, that's where we're seeing a lot of the transmission of the virus, because people are coming to support family. So we're seeing that personal contact, and that's how the virus is transmitting. In our communities, we have so many underlying factors such as diabetes, autoimmune diseases, cancers. We also have the social determinant of health issues such as small houses and overcrowding where you can't really isolate away from family. We also have things like smoking. Cigarette smoking is a high incidence of cigarette smokers. So there's all these different underlying factors that affect our communities. The mental health issues that are arising from COVID are, in some cases, they can be extreme, but you can see just the loss of engagement and spirit in people, as well as most definitely the people who have passed on because of the complications due to COVID. And those aren't people we're going to get back. People really need to know that COVID-19 is real, it's serious, and it's deadly to all of us. We may not think that we'll be affected, but we don't know. And because it's a new virus, we don't know what long-term effects are going to happen. We do have reports of people having all different types of long-lasting effects, but we don't know, and we really don't know how that's going to affect our younger generation. We know it's very deadly for our older population, but we don't know those lasting effects, and we'll be passing those on to future generations. About the COVID-19 vaccines, people need to realize that they are safe. They have been tested. And it's not just tested and approved by Health Canada, it's been approved by different countries throughout the world. So people need to realize that a lot of effort has gone into this. We need to know that after the vaccine, that we have to remain vigilant. We have to keep washing hands. We have to keep wearing masks. It's not that the vaccine is going to, you get the shot one day and you're perfectly safe from COVID the next. People have to realize that they have to build up an antibody response, and they also have to realize that you still can get COVID. I have been vaccinated. You can't be waiting for Johnson & Johnson or AstraZeneca to come to the community. You need to take what we have now and get something in you, get some sort of antibodies. We're protecting against severe illness and death, so we're trying to decrease hospital visits and mortality from the virus. I hope that we can convey to people that, yeah, this is safe. This is the way that we're going to be able to fight this virus and try to get things back to normal. And I think that's what people really need to understand, is that we can't just be complacent and hope it goes away. We have to actively work at this, and we all have a responsibility. It's not just, we have a right to take off our masks, we have a right to do this. Yeah, we do, but we also have a responsibility to the people who want to have this pandemic over.